Hey everybody, I wanted to make another little video today because my last couple of videos I have been talking about my depression spiral, depression spells that I've been going through. I wanted to make a video today. I'm feeling good today and talk about it. Yesterday and today I've been doing better at fighting Franklin, my depression. Um, I don't remember where I found this visualization. It might have been in a guided meditation on YouTube, or it might have been in the Insight app, which I downloaded, which is really good. It has lots of free meditations and things. I had saw this visualization, and it said you close your eyes and you picture a stop sign, and that's to stop the negative thoughts, and you tell it to stop. You say stop. So I found that visualization and that tool really helpful, and I've been using that a few times. I the Yesterday or the day before, I don't remember. I was visualizing Franklin. He's a green monster. He's got sharp gray nails. I drew him one day. Yellow pointy teeth like fangs, snake eyes, and orange horns. That's what Franklin looks like. So I was picturing this monster. And I closed my eyes and I pictured Franklin and I pictured a stop sign and I said, stop. And then I pictured him disappearing, evaporating. So it was really, really helpful to use that visualization. I'm so glad that I started meditating and doing these visualizations because it definitely has helped my mental health. So I have made some decisions about my physical and mental health. I decided that since I have been in a good state of mind the last 2 days, I'm gonna wait until my doctor's appointment on the 20th with my psychiatrist, and then I will talk to him about it and about how I've been having these really rough patches. And what I wonder is if there is something I could take as not as a daily, like something like maybe a mood stabilizer to calm me when I get in that state, that I could just take on the day when it's really bad, because I definitely have linked these depression spells to PMDD. And my doctor knows about PMDD, and he recommended um, omega 3s. I probably mentioned that before. So I'm gonna, or omega fatty acid, any supplement. So I'm definitely gonna do some research and see what seems to be the most beneficial to people. So for who suffer from PMDD. So hopefully I'll be able to find a good vitamin and take that daily, and it'll help me to regulate my mood when I have my period, because it's definitely linked. That these really bad depression spells always seem to happen in like the week before my period, and like a few days. So it's got to be hormonally related. I'm certain of it. I'm also planning on working on my physical health too. I actually today went to my doctor's office and I wrote out a list for the doctor of um, hematologists, blood doctors, that I know that my insurance covers. I told his nurse just whatever he thinks is better, whichever of these two doctors, if he knows one, he like recommends more to pick one. Otherwise, just one, because when I went for my physical, he recommended I see a hematologist because in my family there is a blood clotting disorder called factor 5 disease, factor 5 disorder, something like that. And a lot of my immediate family, my biological family, have had blood clots. I mean, a lot of them also do have other health factors that increase that, but just because that it is inherited and genetic, that disorder. So I definitely want to get it looked at. I also have varicose veins in my legs, and they used to bother me, like appearance wise, because they're big bulgy veins in the back of my legs. And now I don't care. If I want to wear shorts, I wear shorts. I don't care. It's my body. I'm happy in my body. I like my body. Other people don't have to. I don't wear clothes for other people. I wear clothes for me. So I used to be self conscious about them, but now they don't bother me. They just are uncomfortable sometimes. So I get like aches, and then I get really worried and paranoid about, oh my gosh, do I have a blood clot? Do I have a blood clot? And I don't, after I talked to Alyssa, talked to mom, and I calmed down, I know that, okay, it's probably just a muscle pull. I do leg exercises every night because I also have chondromalacia. It's basically a fancy way of saying arthritis. It's arthritis that like younger people get especially when you've played sports. So I don't want to there's really not much treatment they could do for arthritis. It's not like you have a tear, you can repair the tear. So when I went to the orthopedic doctor, he recommended leg exercises to strengthen the areas around the knee, take the pressure off the knees. And then when I went back to him, he was really impressed. So I have been sticking with those exercises, and I do them every other day, and I'm definitely gonna, for the rest of my life, like make sure I do some sort of leg exercises, because I don't want to have bad knees. I remember vividly when I was little, my grandmother, she had such horrible arthritis in her legs, and when I was little, she lived in this house, and I remember she would spend a lot of her time downstairs because it was so hard to go upstairs for her. And when she would go upstairs, she would like almost crawl upstairs. Like she would lean forward, and that, I guess, took pressure off her knee. I don't know, but that was more comfortable for her. So, and she would like go up the stairs very slowly. So I definitely don't want to be like that. I don't want to have these horrible knees. So I'm gonna keep rehabbing in them. Also, I know people, who have arthritis. I know that there's not really any cure for it. It's just, pain relievers and comfort, and so I'm gonna rehab that and continue that. But anyway, so my legs, the hematologist. I have to see a hematologist. So I went to the doctor, and I put in for a referral, and also both Alyssa and I have really bad sinuses. Both of us get sinus infections. We're not biologically sisters, but we have like a lot of the same health issues. So, except she has great teeth and I have really bad teeth. But anyway, so we both for years have had these sinus infections and sinus pain. So when we both went for our physicals, we have the same doctor because we have the same coverage. So, and he's not far from us, so we picked him. And he told us both we should go to ENTs. So I also gave a list of ENTs to the nurse at the doctor's office, and I put both our names, and I said, we both need it. So I'm taking charge, and I have a dentist appointment. It's not till May, unfortunately, but thankfully, knock wood, my teeth haven't been bothering me that much lately. I have really, really, really bad teeth. Like, I have so many cavities, and in the back especially, I've been having jaw pain, so I want to get that checked out. So I have to wait till May. I mean, if it starts acting up again really bad, I can always, go to an emergency room for pain, which I don't really want to do, or I will call and say, listen, I'm in a lot of pain, it's an emergency, and hopefully they'll be able to squeeze me in sooner. But for now, I'm gonna wait till May for that, and I'm gonna get on that. So I'm really taking charge. It's spring. I wanna, spring cleaning. I'm cleaning out my mind, the worries of like these physical health issues, so, and my mental health. So I'm gonna get on seeing these doctors, and then some point soon in the near, like next few months, I want to go to my gynecologist, just for yearly checkup. And I will talk to her about the PMDD, because when I did see her, I mentioned it, and I told her I was on the antidepressant and it was helping. And she said really the only thing that hormonal wise they can do is birth control. And there's only one specific birth control, Yaz, apparently, that she said that studies show, and her experience from dealing with patients have shown that help with the PMDD symptoms. But I don't want to go on birth control because, number one, I mean, I know people take birth control for more reasons, but I'm not sexually active. So, and I know people take birth control and can have a lot of side effects. So I'm worried about that. And also, I know from personal family history as well that when you're on birth control, you are at a higher risk for blood clots. So with the blood clotting disease in my family, I don't want to put myself at that risk. So hopefully, just using these tools and acknowledging it will help. I really am gonna look into the amino acids, omega-3s, fish oil, because I don't really like fish, so I don't eat fish. So definitely, I think that would help too with the PMDDs. But I just really wanted to talk about how important it is to talk about mental health and physical health. And periods are normal. Talk about periods. PMDD. It's so hush hush. I can't talk about my period. I have PMS, and guys make jokes of it. Are you you have your period? You're on your period? Like, it's not taboo, and PMDD is a very real disorder that affects me and affects so many other people. So if you're suffering from PMDD, talk to your doctor, talk to, your gynecologist or your primary care doctor. There are tools and medications you can take to help. So take care, everybody. I was going to do a quick little video again, but once again, this came to over 12 minutes already. So sorry for the long videos. Check out Monorail Tales. My friend Al, who I've talked about, he's now a co-host on there, and he had his first solo interview. I mean, not solo, the other host was there, but that he was taking charge of the interview, and it was with Alyssa. So they talked about working at Disney Store. They talked about her book and how she has her book out and working on it and writing and everything. So check it out, Monorail Tales podcast. All right, guys, that's it. Have a great day. Have a great night, and really take care of yourself, take care of other people, and just be kind. Be kind to yourself and be kind to others. Bye, everybody.